Hello all, I am Dr. Walter from SNS College of Physiotherapy. Now, we are going to see another condition regarding the Hepatitis B virus. Hepatitis B virus. This virus is most life-threatening condition which is arising onto now. Okay. Now, we might have seen the other two videos in the past things. Okay, first we saw about the bacterium and the parasite. Now we are going to see a virus type of disease. So we can go into this hepatitis B virus and we can see what and all things which are affecting, what is the main source which is incubating this hepatitis B. Now it is caused by the DNA virus belonging to the Hepanavirinae family. Okay, so this is a resilient virus which poses a substantial global health burden. Okay, not only in India, onto the worldwide, this is creating a major crisis in the healthcare sector. Approximately 296 million people living with this chronic hepatitis B virus. Okay, so think about this. In this world, there are many millions of people. Among that, 296 million will be a larger quantity in this world. Okay, now going for the global burden, approximately 296, and mortality rate is responsible up to 8,20,000 deaths annually. Okay, among 296, 8,20,000 annually deaths are occurring, and this is inhibiting the chronic liver disease. Okay, so if a patient is affected with the chronic liver disease, there are more chance that these patients will be going for 100% of death. Okay, so the cirrhosis of the liver is most important thing in this HBV. Okay, now going for the next one, that is the transmission and the risk factors. We need to be very careful as this is most common among the world. How? Primary modes, it is going through the parental mode. So how? Blood to blood contact, onto the sexual contact, and to the perinatal, from mother to child, during in that phase also, during the delivery, pregnancy phase also, perinatal phase, from mother to child the virus is transmitting, and to the sharing of needles. The modern culture of putting tattoos and all is going great. So this type of sharing needles is most common in transmitting the HPV virus. Unprotected sexual contact, and this are due to the primary modes. What is the major risk for us as a healthcare workers? What is a major risk? Okay, so we face the rise and the risk of HPV 2 to 4 times higher, because we are directly contact with the patients. We will be treating. We doesn't know the exact outcome and exact medical history of the patients. In some cases, we need to be very careful in diagnosing each and every patient about the past medical history. Incubation period, it is ranging up to 60 to 150 days with average of 90 days inside the human body. So this virus is taking up to 90 days of incubation. As COVID virus took up to 14 days, this is taking up to 90 days. Higher risk activities, actions like needle stick injuries, exposure of open wounds or mucous membrane to the infected area are more than higher risk. Pathophysiology in the clinical manner. Liver tropism, it targets mostly the liver area. Acute hepatitis in the mild stage. Okay, 90 to 95% of adults are going for the acute stage, and they are getting relief as through the medical summary. This is given. Chronic hepatitis going for up to 5 to 10%, but they cannot skip the death. And what is the next one? That is the clinical phases. Through immune tolerant, immune active, inactive carrier, and the negative hepatitis phases, each one will be transmitting to the patient as a triad. Diagnosis. How can we diagnose that this is hepatitis B? HPS-AG, anti-HPS, anti-HPC, HPE-AG. These are the marker tests to rule out this is a HBV virus. So these are the indications which you can see how it is affecting the human body, that this is completely a HPV virus. So these are the marker tests which you can take it note of this. Going for the treatment and the management. For acute phase, so this is going for the antiviral drugs, and the key antivirals, what and all drugs which we can give is tenofovir, entecavir. So these are the most common acute HPV drugs to be taken. Now, chronic will be going for the antiviral therapy, okay, AVT therapy. Okay, this is a crucial thing which is most common to suppress the viral disease which is spreading among the inside of the human body. This is completely based on the monitoring, regular health checkups, regular blood tests, and the regular LFT, that is a liver function test, HPV DNA levels, HBs AG status, and all these things which are most common for the chronic liver condition. And now for the next slide, prevention. As we have a saying that prevention is better than a cure. Okay, so this HPV virus, before it is coming to us, we need to prevent at the early stage. How? HPV vaccination. So we have an immunization schedule which should be followed for each and every childbirth. Yes or no? Yes. Now, this vaccination to be done at earliest. 90%, 95% of protection against HPV will be coming while they are taking the HPV vaccination. And what is the next one? Universal precautions: treat all blood and body fluids at potentially infectious, and safe injection handling is most must. If you are going for any medical clinics or anything, if you are taking place of any going for undergoing any injections, we need to be very cautious that this injection is a new needle. Okay, post exposure prophylaxis, PEP. So this type of thing is a immunoglobulin HBIG within 24 hours of vaccination. It is must to prevent the HPV virus. Okay, so in this we have learned the hepatitis B virus, and which is targeting the liver, and it took the incubation period of 90 days, and the diagnosis, the treatment, the medical management is most. Okay, hope you understood this class. We can meet on next class. Thank you.